Health has confirmed the presence of the South African and United Kingdom variants in the country following genomic sequencing done between January and March in Kilifi. The ministry, however, saying there was no widespread community spread of the variants, this coming as 1,127 more people tested positive for COVID-19, with 25 deaths recorded Tuesday. The health officials now say it was time for Kenyans to go back to the basics in controlling further spread of the virus.
The Ministry of Health has been conducting genomic sequencing in collaboration with the Kemri Wellcome Trust in Kilifi County to identify new COVID-19 variants. The Acting Director General in the Ministry of Health, Dr. Patrick Amoth, saying that out of sequencing conducted between the 28th of January and the 5th of March in Kilifi, involving 55 samples, 19 came out as variants of concern.
16 fitted the South African morphology, and 3 fitted the description of the UK morphology. On the other hand, Kemri Walter Reed in Kisumu did a huge sample of the British troops who train in Nyanyuki and also picked a significant number.
The ministry saying that the variants were associated with people with recent travel history from the neighboring Tanzania.
We have reported these 2 types of variants, but not widespread community transmission, but we are on the lookout for widespread community transmission in case there are the variants that are in circulation.
This coming as the country continued to record high COVID-19 cases. On Tuesday, 1,127 people tested positive for COVID-19 out of 5,393 samples tested. This representing a 20.1% positivity rate.
It's important that we now very seriously go back to the basics. The basics that we know have worked for us during the other 2 waves and that have worked across the globe. The non-pharmaceutical interventions of making sure that we sanitize, we wash our hands with soap and water and sanitize, that we wear our masks.
The number of patients in the intensive care unit shot up to 135, out of whom 34 were on ventilatory support and another 93 on supplemental oxygen. Another 13 patients are in the high dependency unit. The ministry cautioning some facilities against charging huge amounts of money to patients seeking admission to the ICU.
That we are in a pandemic, and this being the case, it is not the time to punish our people through some self-seeking, money-minting, opportunistic escapades. Our people have gone through difficult times with the virus.
Doctors calling their own to present themselves for the COVID-19 jab.
This month is now recording a very high number of infections amongst healthcare workers and amongst our doctors. And just to say that we have 10 doctors currently admitted in various facilities across the country, battling from moderate to severe disease. And this is a big concern for us.
25 patients lost their lives, out of whom 3 occurred in the last 24 hours and 22 on diverse dates due to late reporting. The Interfaith Council for National Response to Coronavirus Pandemic is discouraging serving food to mourners, saying this could be contributing to the spread of the 3rd wave of the disease.
The leaders of the service must also wear the mask throughout, even when speaking to the microphone. All those taking part in the service or taking a special part in the service should have their masks on as well.
Meanwhile, the vaccination exercise for prison staff was launched Tuesday with 28,000 prison staff targeted.
I urge all my personnel to take part in the immunization process, as this will help in having a healthy working service ready to serve in the front line.
So far, over 45,000 doses have been administered since the exercise was rolled out in the country.
The digital platform, Chanjo Kenya, which will allow for self-registration, is being tested this week, and that will reduce the number of people lining up. In fact, when you talk about apathy, the reports we get from many centers, people are now queuing as early as 5:30.
Nancy Okware, Channel 1 News.